All right. Again, thank you for joining us for our webinar tonight. My name is Sean Johnson, Director of Marketing with Aerolase, and I will be your moderator for tonight for our webinar on rejuvenation and hyperpigmentation for millennials and beyond, an algorithm to choose the ideal laser, presented by dermatologist Roberta Del Campo. Just a couple of housekeeping items. At the end of the presentation, we always have a live Q&A session. You're always welcome to type in a question at any given time during the webinar. But we will open it up for Q&A at the end of the session. Now, if we do not get to everyone's questions in the allotted time, we will follow up afterwards to address those questions. Now, I would like to introduce our presenter for tonight. Dr. Roberta Del Campo, MD, is a board-certified dermatologist who specializes in medical and cosmetic dermatology. As a fellowship-trained cosmetic dermatologist, she has extensive training and expertise in a wide variety of cosmetic treatments. She is known for her attention to detail and her ability to develop an individualized treatment plan for all of her patients. After completing medical school and her residency, she continued her training by completing a fellowship in cosmetic dermatology and laser treatments in Ann Arbor, Michigan, in combination with an academic faculty appointment at the university. Now, in addition to practicing in the Miami area, she is also involved in dermatologic research in various dermatologic organizations, including the American Academy of Dermatology and the American Society of Dermatologic Surgery. There at ASDS, she was selected as one of 7 future leaders in 2018. Now, for her year-long Future Leaders Network project with Dr. Tina Ulster, which is pertinent to the webinar tonight, who is one of the country's leading laser specialists, she developed the first web-based interactive algorithm for the purchase of laser and energy-based devices, which is the first of its kind and will help guide fellow dermatologists when investing in laser devices. She has published more than a dozen articles in her specialty and currently serves as a consultant and trainer for several aesthetic companies, including Aerolase. So having said that, I'm going to give it over to Dr. Del Campo, and she will take it here.
All right. Hi, guys. Thank you for your time. I know it's a Wednesday night, 9 o'clock, but I think we're going to have a lot of fun, and I will tell you that I have continued to learn a lot with this device, and, I'm very excited about having this in my new practice, and I'm happy, that I can share my experience with you all. I also want to thank Aerolase for not only promoting education for their devices, but also for educating us on how we as providers can be successful with our patients. So that being said, this is a quick overview of the agenda, and I'm going to talk about, my game plan in terms of how I've used the device to increase revenues in my practice, but also, how I've diversified my practice and going out on my own. So let's go ahead and get started. There we go. Okay, so just a quick background. You can see here, Sean, I think already hit all those, so you can just go ahead and take a look at that. And, my quick background is that, I joined a private practice right out of fellowship. I did a fellowship at the University of Michigan after residency in cosmetic dermatology. And, when I was looking for practice, obviously I was looking for a very aesthetically prominent practice down here in Miami, where I'm from. And I joined a fabulous practice here in South Beach. Was there for 4 years, loved it, but decided, it was time for me to go out on my own and to really grow my own image, my own brand, and also, create the ideas and the brand that I had imagined, for my whole career. So I opened a practice recently, actually very excited. I opened it August 2nd here in Miami. And, my goal really was to reach more patients, reach a wider variety of patients, including age, different skin types, and really looking for advanced technology that I could bring into my practice to not only better serve my current patients, but really at the end, we're all trying to grow. So I was really looking for devices that I could have that would make me unique and make me a provider that would stand out to patients when they're looking for their care. So what really drew me to Aerolase, and we'll kind of get into the details about the actual device, but, we all know that the millennial market is huge. And, the millennial market is the most ethnically diverse population, and I see it very frequently down here in Miami, obviously treating multiple skin types. And most commonly, I treat a lot of Latin American patients who tend to have a darker type 3, type 4, type 5 skin type. And so, I started thinking about how can I reach these patients that make up more than 30% of our population. The millennial market, why are they important? We know that education specifically is driving skin health, and we know that millennials want education. When you stop and think, when I see patients, wide variety of ages, I stop and think, what makes the millennials unique? How do I have to approach that patient differently than I might approach an older patient? And, really it comes down to them being a little bit more skeptical in a way, but also a little bit more educated in terms of different devices that are on the market. They have social media to look at, to ask questions. They come in and say, what is this device? What's that device? They start researching the names. And they're obviously very cosmetically inclined. I mean, this again goes back to kind of pop culture and social media. And we know that this population specifically, they become very loyal. I will say that the young population that I have, the millennials that I have, when they come in and they're happy with the treatment and they feel comfortable and you essentially build a bond with them, they will come back again and again and again. So this is really a population that I feel very strongly about targeting. So what are their needs? What are they looking for? We all know that millennials, and I think this is a perfect picture, they like to do 10 things at once. They're checking their phone, they're thinking about what they're going to do tomorrow, what they're going to wear tonight, they're answering an email, they're constantly multitasking. So they want to get in and get out. They want to come in and do a very quick procedure, get the results, and be on their way. The other thing that we know that millennials look for is they want the latest and greatest. We hear the term all the time on social media, all the time, on the TV, is they want what is the new best thing out there. And they want to make sure that they have the best technology on the market. And they want to keep up with their peers. Point blank, oh, my friend did this, I want this. And we know that if you make one, patient or customer happy, it's going to attract 10, 20, 30 more. They also want something that has no downtime. Millennials have an event later in the evening. They have to wake up because they have X, Y, and Z. And so they want to come in, have their treatment, look great, and go on with the rest of their day. The other thing I think that's important is that they absolutely want to keep their skin health, keep their skin young and healthy. We used to think about treating skin to make it look great and just make it look aesthetically pleasing. But now I think we're targeting skin health. What makes your skin healthier? Look at commercials, look at social media. Skin health is a common hashtag, skin health is a common phrase, and skin health is a common topic of conversation. So I think, we need to address all these things with millennials while we keep the discomfort down. So how do we market to millennials? Social media. I mean, that's obvious to all of us. Social media is huge. I tend to do a lot more on Instagram, but, I absolutely think trying to broaden your horizons is key. This allows you to engage with your customers. It's actually a really good chance to build a bond before even seeing the patients. I obviously have a public, Instagram account. I like to post, and I allow patients to message me through Instagram. If I can answer it in a quick response, I answer the question. Otherwise, I say, please call the office. I'm happy to discuss with you during a consultation. But it's a good way for patients to feel connected. And millennials want that connection. They want to feel that they know you almost by your first name. They really want to feel that they connect with you, and then they're going to trust you and believe what you say. The other thing that's important with Instagram or other social media is really it stimulates new ideas for the future visit. So you treat a patient, with the Aerolase laser, you post it on Instagram. A patient that you may have treated 3, 4, 6 months ago that you haven't seen since you had that device might say, hey, I noticed this new device. Tell me about it. What does it do? Can you explain it? What kind of results can I get? And then commonly, then they say, okay, this sounds great. Sign me up. So it really sparks conversation. It lets them know what you have. Many people are getting away from reading about every single treatment that you offer on your website and really are using social media because they're visual. That's another thing to keep in mind with millennials specifically. They're visual. They like to see what the treatment looks like. They like to see what the results are going to be. So really having that visuality, I think, is really important. And the other thing that's important to keep in mind with millennials is they want to be educated. So that's where that whole Instagram or social media comes up, YouTube, where you can explain the procedure. You can explain what to expect prior to or post-procedure. And you can really give them the guidance. So when they walk in the room, it also saves you time. You don't have to go all through that. They know what to expect. And then you can sit them down and say, here we go, and start the treatment. So be authentic. I think this is important. There's some pictures here that I put just so you can get an idea of what I do for my Instagram. But I think it's important to, number one, mix it up. let them know who you are as a normal individual. So show them the treatments you do in the office, but show them, some things that you do outside the office. Get them excited. Here I posted coming soon. I got, my patients excited about the new office that I'm opening. But you want them to feel, again, connected. I think connection is key. And you want to show that personal side because, number one, it's going to show that you're confident as a practitioner and as a provider. It's going to show that you're a normal human being. And I will tell you that one comment I get often from patients is, oh, you're just like me. You're just like us. Oh, you're normal. I'm so used to walking into an office and talking to a doctor and feeling like, a little bit intimidated or, not really sure how to interact. The more natural you are, the more you connect, the more comfortable they're going to feel, the more treatments they're going to want to do, the more they're going to want to come back just to tell you about their day. And, I also commonly get patients that just like to come in. They say, I just like to come in. I'm coming in for this one thing, but they want to come in every other week and just, to see me and the staff and to feel involved. So the more you show yourself on Instagram or other social media, and I keep saying Instagram just because I tend to be heavily in Instagram, the more you use that, the more you can connect with these patients, and then they can feel that they really know you and understand you and trust you. So obviously you also want to educate about your art. So, throw in a few about your family, about things you like to do outside the office, but then focus on your treatments. Explain it. So you can see in this particular image that I'm doing the treatment, then I explain what is this technology, what does it do, what is the downtime, who can it be used on, what areas, what are the results they can expect. You're not going to be able to answer obviously every question about it, but again, going back to saving you time in the office, they already have some knowledge about it. But also it gives them an idea of whether or not they're going to be a candidate. And, I love nothing more than putting Aerolase, no downtime, how fast the procedure, 15, 20 minutes for the LightPod Neo. So it's really nice to be able to also kind of highlight that so that catches the eye of, oh, this is quick, easy, something I can do on my lunch break. Maybe it's something I should come in and ask more questions about. The other thing that this teaches them is to know that you are a good provider for this, meaning they see that you're doing the treatment on patients, that you know about the treatment, that you're confident about the treatment. So the more you teach, the more knowledge you can show that you have. And the more knowledge you can show you have, the more they're going to trust you because they want an educated provider, not somebody who just bought a device and wants to use it because, quote unquote, they like it because they heard that so-and-so had or so-and-so used it. They know that you're educated on that device, you know how to use it appropriately, and you know how to give them the best results. And this is key. You obviously want to make your patients happy, and if they're happy, then they're going to spread the word. But, you can't just rely on verbal spreading the word. You want to make sure that reviews are there. And this is perfect timing because I had a patient today who came in, who actually is in from out of town here for Basel, and just said, I decided I wanted to do some laser hair removal. And, I said, oh, okay, so how did you find me? Oh, I went on Yelp and I just started looking up dermatologists in the area and you had great reviews on Yelp. And then, I happened to look and see, do you actually have a device that can be used for that? So I decided to come in and see you. So, having those reviews sparks trust, sparks, knowledge, and it really gets your patients to feel comfortable right off the bat because especially when you have patients that really believe in you, they are going to take the time, as you can see here, to not write a one-liner, but to actually put, their positive experience there to really build an image for you. And you can use patients to help you build a positive image. So ask your patients to do that. The way I also do it is I actually send out emails. I set up, I'm working with a company who does SEO, and I set up an account where after each patient is seen in the office, one of my associates sends out an email that says, would you like to provide a review on Yelp or Google, et cetera? And then they can choose to do that. So, send that out and you might get, I get one, probably I've had maybe 3 or 4 in the last, few weeks. So it's not a ton, but it's enough that it gets you out there, it gets the numbers up. And so just don't be shy and find kind of like, ways to do it. If you don't feel comfortable doing it, find ways to do it either through email or through an associate or, a staff member that can say, hey, by the way, if you're really happy, we would love for you to do this. So you don't feel uncomfortable. There are many ways you can do it, but just do it. And be your own influencer, right? Share your experiences. I actually love sharing my experiences. I'm not shy about it. I like to show the results, and I like to show something I'm passionate about. As you can see, even the way that I'm talking about this device, I'm so passionate, I like to share that. So if you get out there and you show the patients, look, this is what I did, these are my results, they are going to eat it up, they're going to love it. And, you know, as we would with our providers, if I see that, you know, somebody I trust did X procedure and they're so happy that they're showing me their results, I'm going to want to do it because I'm going to trust, hey, they did it to themselves, they're happy with the results, I'm going to do it. So I would say that's very, very, very powerful, and it's another thing that I absolutely recommend you do because I have so many patients that bring that up. Oh, I see you did this. Your skin looks great. So it's another way to open the conversation and to also have the patients trust what you're recommending because you did it. Some of my old PAs, I must say, I just have to give actually a shout out on that because I love my staff, and they know that I'm a huge proponent. When I'm happy and excited about something, I'm like, here, take pictures, post this, help me do that. So, and they can also attest to that. I think it's just so, so, so important. And I make them do it too. I'm like, hey, do you mind, you know, if they're happy with the procedure, let's post it. You know, because patients see them in the office. So that's something else to think about. Have your staff get involved. You know, if they're confident in it, and they feel, you know, really proud about the results, have them help post it to their friends. It also brings in new views to your website and to what you can offer in the office. So not only yourself, but staff. So marketing to millennials, here are the key takeaways. Obviously, you want to be authentic. That's number one. Millennials are the first ones to see through crap, if you will. They really want to be authentic. They want to see somebody who they feel they can connect with. And they want to see somebody who is educated that can educate them. They are very, very loyal. And, you know, I would say at the end of the day, once you get them and you keep them and they're happy, they are the ones that are going to tell all of their friends. They are not shy about procedures they do. They're at the forefront of the procedures that are out there. They don't mind sharing it on social media. So really targeting, you know, millennials to believe in you and believe in your products and your treatments, I think is huge. Some things to think about are setting up referral or VIP client programs. You know, that's something I'm in the midst of doing at this point. You know, to be upfront, I have not done that. I'm a new practice since August, but it's something that I know I have fellow friends that have done it and have had great success with that, establishing loyalty programs. And, you know, most importantly, and this is what I strive for on a daily basis, is connect on commonalities. I'm sure most of us are taught this during, you know, our training, but when you ask a patient, oh, where are you from, in casual conversation, oh, you know, I'm visiting from, you know, Boston, oh, I went to medical school there, oh, so what are you doing later today, are you going to go out to dinner, what are your plans, oh, I'm going, oh, I love that restaurant, you know, so really finding commonality to connect with the patients. It sparks that trust again, it starts conversation, which, you know, obviously we kind of want to cut the ice anyway. So it just loosens things up and allows you to connect with your patient. So find a question, just ask 2, 3, 4, 5 questions, and I can promise you're going to find some commonality that's going to really connect you guys. Okay, so let's kind of, you know, switch a little bit and talk, you know, we've talked about why millennials are important. They're a big part of our business. They're at the forefront of technology, they're forefront of social media, and they can really be your biggest advocates. But now how do we think about rejuvenation for this group? One thing I would mention is we look at the numbers here, 3.3 million procedures performed by the ASDS members. And most of these obviously are targeted towards anti-aging treatments. My algorithm, which we'll get into in a moment, was actually based on the 2016 statistics. And interestingly, it was almost identical to what we see here in 2017. However, 1 and 2 were switched. So number 1 was facial redness. Number 2 was more of the sun damage, wrinkles, etc. So the point is, what this is trying to show is that we have 2 sets of millennials. We have the young millennials that are really just looking for prevention, looking for ways to help make their skin healthy, and really starting young. And then we have others at the higher end of the spectrum, if you will, which would probably be more of the age range that I'm in, although unfortunately I'm not really technically considered a millennial, but I'll pretend. But, you know, those individuals are really looking to treat what they've already caused, the sun damage they have, the wrinkles that they have, and they're looking to not only, you know, prevent, but also to rejuvenate. So the younger millennials, We look at prejuvenation. So you're looking at laser collagenesis, stimulate the collagen, and collagen is a key word. This is in bold for a reason. I cannot tell you how many times a day I use stimulate collagen, improve your collagen, make your collagen healthier, etc. Collagen, collagen, collagen. Patients love, and I know we all know this, but love the word collagen, and I think it's become such a layman's term that you can use it and patients will connect with it, and patients just want collagen. So use it often. We also obviously use Botox, fillers, and skincare regimens for more of this prejuvenation. For more of the quote-unquote mature millennials, not only are we trying to prejuvenate or prevent, we're also treating things like sun damage, facial redness, age spots, hyperpigmentation, fine lines and wrinkles, and it's a similar treatments that we recommend, similar algorithm, if you will, lasers, peels, skincare, prevention. But we potentially have to get a little bit more aggressive and start thinking about how we can actually address those specific skin concerns in these individuals. They obviously want to see the results instantly. I think this is kind of going back to what we talked about with millennials. They want to come in, they want to get their treatments done, fast, but they want to see results. They don't want to wait. I mean, I'm going to give just the example of Sculptra. Sculptra is not something that I tend to use a lot. I like Sculptra. I think it has its place, but the example is that Sculptra is something that you have to do 2, 3, 4 times. You have to wait X number of months. Most millennials that I have come in, when I talk about Sculptra, they ask about Sculptra, and I say, well, the results take X amount of time, you'll see the results, but keep in mind, they're like, I'm out. They want results right now. So being able to give them a treatment where they see that glow and they see those results immediately, which we see with this device, it's a game changer. They're super happy with the results. They have a quick treatment, no downtime, and they're ready to go. One thing that I've found in combination that works extremely, extremely well is the glycolic peel. And doing a light peel, I do a 20% or a 35%. Somebody who's quite old, maybe a 50%. But the point is, you're adding that quick satisfaction because they're getting an extra bit of radiance. They're getting an extra soft feel to their skin. You're cleaning out their pores, and they're getting kind of a double whammy. And I will tell you that for a patient that wants a wow, 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 or they have other, skin concerns like hyperpigmentation, that is absolutely a combination that I recommend. And, I do charge separately, but it's a little bit discounted because of the package. But patients that come in and they say, oh, I just want the Aerolase Neo. I just want a little tightening. I want to get started on the series, but they don't necessarily need or want that glycolic peel. I almost always do a light exfoliation with a lactic acid pad. I'm talking 9 out of 10 times, 10 out of 11 times, etc. And all I tell them at the end is, look, I'm just going to give you light exfoliation. We just did a nice laser treatment, but let me go ahead and just remove all the dead skin and just make sure that you have that extra glow. And, personally, I use the Glow Biotics just because it's nice and gentle. I love it. I use it at home as well. It doesn't cause any irritation. But the point is that it gives them that extra wow factor. And it takes you an extra 15, 20, 30 seconds. I don't charge them extra for it. Obviously, it's part of my treatment, but it gives that extra wow. So it's just something to think about. And you'll come up with your own combinations. We know that patient comfort is key. One thing that I absolutely love about this laser is there's no pain. And I will tell you that coming from, my last practice that I was in, we didn't have this device. We had an IPL at the time and several other devices, but I would say comparatively an IPL. And, IPLs, they're not painful, but they're not necessarily comfortable. And so most of my patients that have done IPLs in the past, when they come in and they do the Aerolase Neo, they're like, wow, this is amazing. Like, it doesn't hurt like the IPL did. I didn't have to use gel like I did with the IPL. It's so much faster than the IPL. Oh my gosh, I don't have the little brown spots. This is amazing. This is so much better. I'm so, so, so happy. Thank you. So, comparatively, I think the more you can keep the patients comfortable, we know now that it's not the same motto of no pain, no gain. Patients want to come in and have a very pleasurable experience, and we want them to come back. And if they're uncomfortable, they're in pain, they're going to dread it. We want them to come back because they love the results, and they know that there's no pain, and it's quick and fast with great results. So these are the three things obviously required for success. I'm a big believer in combination therapy. And whenever I have patients come in and they say, I want X, I always say, okay, this is a great treatment, but here are other things we should think about if you want your maximal results. So I think combination therapy is key. Just like any other device, the Aerolase Light Pod Neo, it's not a one-stop shop for everything. It's going to do X, Y, and Z, but yes, we have to think about toxins and fillers for dynamic lines. Yes, we have to think about, using at-home skincare to continue to improve the health of our skin and make our skin look better on a daily basis. So it's really important if somebody comes in for consultation that you're not only talking to them about, this particular device, but saying, hey, we can maintain these results. We can improve these results and actually make them better if you continue this at-home care, skincare regimen over the next 3 or 4 weeks until I see you back. So this is actually my favorite part to talk about because, I'm very, very passionate about this laser. And, it was a laser that was actually a little bit unexpected for me. It was a laser I'd never heard about. I did a cosmetic fellowship at the University of Michigan. And, understandably, we're a little bit, boxed in. So I was only exposed to X devices, went to a private practice, worked with another doctor who had X devices. And in my mind, although, I'm going to conferences and I'm trying to explore, we all know that you can't look at every single device at the conferences. We're going to, different lectures. We're meeting with people. So I didn't have the knowledge actually about this particular device. And I happened to go to something called the Dreamer Conference, which is doctors reaching for excellence in aesthetic medicine, and heard about this device. And it intrigued me. I'm like, this is actually too good to be true. There was a little bit of that going on in my brain. There's no pain. There's no downtime. Patients are really happy. It's a quick treatment. Okay, how is this possible? Well, sure enough, I had a rep come to the office so I could demo it, and I was blown away. I had one demo. I said, this is pretty amazing. It's something definitely to think about, but I was still in another practice. So as I decided to move forward with my own practice, it was something that came to the forefront of my brain when I started thinking about my first device. Now, based on this algorithm, and the algorithm really came about by being a fellow and coming out of fellowship and having other residents reach out to me and say, hey, I know you're now in a private practice, you did a fellowship in cosmetics, what laser do I buy? And I said, look, I don't even really know. I know that, we all think IPLs, we all think, red, brown, but how do I decide? So I actually decided it was best to look at statistics. And so I worked with Tina Alster, actually applied based on this idea. I applied for the Future Leaders Network at the ASTS and applied to work on this project for a year. They match you up with a mentor, and I was lucky enough that Tina Alster showed interest in my project, and she wanted to be a part of it. So she and I spent a year working on this algorithm, looking at statistics and numbers and what's the most common, treatments done, what are the most common complaints from patients, how do we go about guiding providers and making an educated decision when it comes to investing, because we know that these devices are quite expensive. So this algorithm was put together, and I will tell you that as I was going through the algorithm myself, looking to open my own practice, I said, it fits exactly with the first question. Do you have an energy-based device or a laser that treats facial redness? That's, at the time, again, was the most common complaint by patients. Yep, it does. Check. Next one. Does this fit, do you have a device that treats skin rejuvenation? Yes, this does. Check. Number 3, number 4, it hit the top 5 complaints by patients, the top 5 treatments that we do on an annual basis as cosmetic doctors. And then I said, okay, well, here are the 3, 4, 5 devices that I can think about that would fit all these. However, what makes this unique is the fact that this can be used on any skin type. And I will tell you, when I was opening my practice, what the most important thing for me to do was to invest in devices that I could use on anyone. I was so tired of turning away patients, at my other practice saying, oh, unfortunately, I know you want to go to the beach, you're tan, you can't use this device. Oh, unfortunately, you're type 4 skin type, you can't do this device. Oh, unfortunately, I can't help you because. So it was very, very important to me to be able to accept patients and not say no, and to be able to give them a treatment that they would help them to improve and that they would be confident in. So, I think it's really important to really think about your patient base, who you're treating. And I will tell you that I don't care where you are in the country, because everybody can say, oh, it's because you're in Miami. Millennials and, number one, most ethnically diverse population, but also just in general, we know that, the minorities are becoming a majority. And if you invest in devices that do not treat that population, you are going to be turning a lot of patients down, and you're going to be not only losing a lot of revenue, but they're going to go elsewhere because they're going to say, I really wanted to be treated, and they just want hope, and they want, treatments that can at least make them feel and look a little better. So to be able to offer that to your patients, I think, is key. So, that's how I found the Aerolase. It was really about finding devices that fit into my algorithm that I had developed with Dr. Alster, and saying, hey, I have these top 5. This one blows the other ones away because this one I can use on X, Y, and Z. And not only that, but it's actually approved for other medical treatments as well, and it can do a wide variety of things. So, investing in my first device, I can't stress, this device enough. I mean, it's a game changer, and it's something that I highly recommend for someone that's starting a practice and wants to be able to use the device on a daily basis. So this is actually just what I alluded to. I mean, it treats so many different conditions, and, I will tell you that one thing I absolutely love is that, yes, you can use it on any skin type, but why? Because you don't have the damage to surrounding tissue. It goes deep enough that it bypasses the melanin, and you have to know that. I have a lot of patients say, well, I don't understand. I was told I'm type, 3 or type 4 or type 5. I can't do lasers. And I say, actually, based on this technology, you can, and here's why. So it goes back to educating your patients, making them feel comfortable with the treatment, and, knowing that in your mind, this is such a safe treatment for your patients because of the wavelength and because how quickly this pulses, that you're going to be able to use this on anyone, even tan skin. And just how quick it, the energy is, the technology, there's minimal to no pain. We all know that the faster you kind of hit something versus a slow, strong punch, it's going to be a lot less uncomfortable. I'm not going to go through all this. I think this is for your general knowledge, but you can see that this technology treats all of these different indications, and here's how it works, and I think, again, understanding chromophores. I had a patient today who actually asked me, how does this work? And I said, I don't want to get too scientific, but it's based on chromophores. Here's what this means. So again, knowing, your information and being able to educate patients is key. All right. And I know I probably need to speed up. I think I just am going on and on about this because I love it so much. But I will tell you that PIH and melasma is probably the #1 indication I had patients come see me for. Probably because I post a lot on social media, because I've dealt with it. It's why I became a dermatologist, but also because it's becoming more common. I mean, we're all out in the sun. Again, we have a lot more darker skin types, coming into the office to be seen, to be treated, knowing now that there are devices and technology out there that can be used. And I think being able to understand that there is hope, right? So used to patients coming in on melasma, I was told by another dermatologist, there's nothing I can do. And I always say that's absolutely wrong. Here's what we can do. You need to set realistic expectations, but talk to them about the difference between, epidermal and dermal layers of sun damage and pigment. Talk to them about the potential worsening of treatments such as IPL. IPL is not only, in my opinion, very risky when it comes to causing, discoloration, right? So hypopigmentation in darker skin types. But many of these patients with melasma have rebound hyperpigmentation. I see it often. So knowing that you can use this technology without that potential risk makes me feel comfortable, and it's going to make your patients feel comfortable. And you want them to come back. You don't want them to come back sad. You want them to come back happy. So feel comfortable about what you're recommending, and with this particular technology and application, you will absolutely feel comfortable with it. Here are my results. I mean, this this was actually at the training. I purchased the device, we did the training, and I said, oh, here, let me feel it. Of course, as I mentioned, I like to, and not only for social media, but I like to try everything that I offer. I want to know what it feels like. I want to know what to expect. And so I did the treatment, and I will tell you, I'm even getting goosebumps right now. Like, it was so much better than I expected. I mean, I had to post it. The minute I saw it, I was like, boom, that day I was like, wow. I mean, I was even blown away by my results. So, show your results, be proud of them. And when you have a device that gives you results, you're going to want to tell everyone about it. All right, so just knowing that obviously this can treat multiple indications, you have high patient satisfaction, it can be used in any age range. Here are some pictures that we can see. I think this is fabulous. I mean, it shows not only is it targeting the hyperpigmentation that we see with melasma, but we know also with melasma there's hypervascularity. So this also treats the red. It helps to calm the skin. It really blends nicely. And I think a huge takeaway, too, is look at the skin texture and the overall radiance, brilliance, and tightness of the skin. Majority of my patients come back, and the first thing they say is, I cannot tell you the number of compliments I've gotten because patients come up to me, or friends come up to me, they don't know what I did. They just say, wow, your skin looks great. It just makes the skin look healthy, glowy, tight, and you get an overall just healthy-looking appearance to your skin. So you can see that here. Another case of melasma and dark skin, I think this is fabulous, and this, as you can see, with one treatment, and there you go with the glycolic peel, which I love for hyperpigmentation. I'm just going to go through these. I don't want to spend a lot of time on them because I want to leave time for question and answers, but here are some, before and afters that you can see. Skin quality right there. I mean, that is a great example of this. Acne, discoloration from the acne. Again, acne. Texture is improved. Redness here, you can see it works fabulous for that. And just look at the pore size and overall clarity of the skin. Bruises. I actually, interestingly, I know it's something that I think was mentioned by my trainer. It's either that or it was in a protocol in the booklet, but I've actually been using it to prevent bruising in patients as well that have a high risk of bruising. And I will tell you, I've only done it in 4 patients because, yes, it takes an extra few minutes, and yes, it's not something I normally discuss. But when I've had patients that say, I have an event coming up where I always bruise, is there anything we can do? Because I've been wanting to do my tear troughs, and it freaks me out because I say, look, let's try this because it's something that can help to prevent. And I'm telling you, 4 out of 4 patients did not bruise at all. I mean, I've been blown away because these are patients that always bruise. I've been treating years and years and years. And yes, it might be just one bruise, but they don't want it, and it helps. But it also helps to speed up the bruise healing. So I use this as well post-treatment for anyone that has a bruise as a complementary treatment. So I think in summary, for the NeoSkin Rejuvenation for Millennials, this is a fabulous, fabulous, fabulous device for this. It's extremely comfortable, number one. It's safe for all skin types. It gives you quick, natural results, and it addresses multiple concerns. One thing that I forgot to mention that I put on one of the previous slides is that, one of the beauties of this particular treatment is I have a patient, if I have a patient that comes in for melasma, but they also, in the upper lip, they also have a little bit of extra, hypertrichosis, a little bit of extra hair there, which adds to the shadow, number one, but also women don't want that there. I say, oh, look, great, I'm treating the melasma, but I'm also going to go ahead and hit, the hairs as well, and I'm going to help you with the extra hair there. And they're like, oh, wow, really? You can do that? Oh, and then you have a little, cherry angioma on the right cheek. Let me go ahead and treat that too. Let me just change the hand piece here. I'm going to go down to a 2 millimeter. Boom, it's gone. So the point is that they feel so great because they came in for their melasma, but not only you're treating the melasma, but you're treating, the hair, you're treating an angioma, you're treating some telangiectasias around their nose. So they're getting a very comprehensive treatment that maybe wasn't expected because you're so focused during the consultation about talking to them about melasma, but now here you're able to say, look, as a courtesy, I'm going to go ahead and do this as well. It only takes me a few extra minutes, and this is going to be great. And they're like, wow, thank you. And then they also leave with better results because you're not only treating the melasma, but you're making their overall skin, color and quality look better, and you're making the skin look smoother. And so they're going to be happier with the results because not only does the melasma look better, but their skin overall looks healthier. So being able to have a device that's a quick change to treat, a different indication or a different quote unquote problem within seconds is huge. Patients love it. And, they have a great experience overall. So I think what's really important is obviously having a patient leave happy. And I will tell you that this particular device has given me more compliments over the last 4, now 5 years, treating patients with multiple devices. I've had more compliments about this device than I've ever had. Patients just saying, this is great. I'm so happy you bought this. And I'm very upfront. Look, I started, the practice and I wanted to buy the very best device out there as my first device. And they're like, I see why you bought it. This is amazing. And so they're very happy and they tell everyone about it. So, be passionate about what you buy. If you buy correctly, it's easy to sell because you're going to be able to get the patients in there that are happy, and they're going to be appreciative to you as a provider to say, I bought this device because I wanted my patients to have the best out there. And then they're like, thank you. That's why I come to you, because I know you stay on top of technology, and I know that you always want to offer me the best treatments out there. So here's a picture before and after. We know this became pretty infamous, if you will, because of Today's Show, and I've actually had patients come to me saying, I saw this on Today's Show, so it's great marketing. So know that the Aerolase team, they're behind you, and I will tell you that since purchasing the device, they have been available, accessible, anything that I need, and patients are very happy, obviously, to be able to see that there are celebrities and people out there that are doing this and are happy with the results. So marketing is key, and they are behind it. Also, you can see here that they work very hard to help increase the revenue in your practice. Doctor finders on Aerolase site, number 1. Number 2, I've actually, had patients come to me and say I actually called them and I asked them who in the area, and boom, they recommended you. So, being able to establish those relationships and having the team recommend you is huge. Having it on your website, they give you plenty of content that you can use however you so choose. And then obviously putting out the in-office, promotional materials. I have obviously the laser visible in the room that I use most often, and I'm always quick to point out, hey, Janet, can you move that over here a little bit? And, they're like, oh, what is that? So drawing attention to your device, marketing the device in your office, having your staff educated about the device, I think it's huge. And the Aerolase team will absolutely support you in any way that you need to get the word out there. So, I wanted to put this here to let everyone know that it can be done. And this is, to be frank, a little bit of a challenge. I opened an office very, very quickly. I'm in a temporary space with 2 rooms. It was very difficult initially to kind of redirect patients in terms of them being able to find me, because they had to do it all on their own, find me online, et cetera. The point is that with all of those hurdles, I paid off my device in 3.5 months. So the point is, if I can do that, being in a 2, room space with a brand new, office, et cetera, anybody can do it. It is something that just sells itself, and patients are so happy. They will tell everyone. They will come back and do it again and again and again. And I now have patients that I've treated with their initial series of 3, 4, and they're like, I'm coming in every month to do this. I love it. I'm happy. It's fast. So you have the right device, the right treatment mix, you have an effective treatment, and a comfortable, fast treatment. They will come back again and again. So we don't have to go over this again, but I guess the last thing I want to point out is the last point is just keep in touch with your patients. Obviously most of us have email blast lists, but send out, information about your device, educate them, send out promotions, keep in touch with them, engage them. And the more that you get them in the office and keep them happy, the more they're going to want to come back. So connect, connect, connect. And again, when you have the right vendor partner, it's easy. so that is it. I appreciate it, and I appreciate everyone's attention. I'm going to open the floor to questions and answers, and feel free to ask whatever you would like.
All right, so as Dr. Del Campo said, thank you very much for your presentation. Awesome. And so we will open it up for questions here. I believe we do have a couple questions that came in immediately. Here we go. Dr. Cleef is asking, what exfoliant did you happen to mention earlier with your skincare regimen?
Exfoliant. I think we were talking about just exfoliating the skin after the treatment. That's the one thing that I had mentioned. So I use Glow Biotics, the Glow pads. They're a lactic acid pad, and I use that to exfoliate after every patient now. I did it kind of as a trial for somebody who didn't want necessarily a full glycolic peel. But I wanted to give them that extra dewiness, radiance, and kind of that clean feeling. And I've just been using the Glow Biotics pads, one pad per patient after the treatment, quick swipe. And then I put the Glow Biotics Hydra Cream oil on any patient that's not acne prone. If they're acne prone, I don't use it. But otherwise, I add that to give them a little radiance when they walk out the door as well.
And then following up on that, just in terms of what kind of like a skincare regimen do you happen to like? I mean, there's a lot of skincare lines out there. Is there anything that you like to recommend?
Absolutely. So I'm really into Naya 24. I'm a big proponent of their creams. I will tell you that I've just now gotten into them. It's something I trialed a few years ago, and as I've kind of expanded with their skincare line, I absolutely love it. It's gentle, which obviously want to recommend something that can be used by almost all skin types. It's a very straightforward skin regimen. They have very nice feeling, elegant products. And the other thing that I love, obviously, is the niacinamide. We know that that's great just for overall skin health, collagen stimulation, as well as just calming the skin. So I'm a huge proponent of Naya 24. And I'm also into NeoCutis. I think NeoCutis is great. I like the growth factors. I used to love Regenica, but Regenica's gone now. So I'm as well into growth factors. Those are my two big ones.
And now, do you recommend a skincare regimen with every single treatment that you do?
Absolutely. I think skincare regimens are huge. If they're not doing something at home, they're not going to get the full benefit of the treatment. And also, understandably, we also want to prevent. So it's getting them on a regimen for anti-aging purposes as well. Specifically for melasma, I know this is probably going to be a question that comes up. I absolutely recommend hydroquinone as well. For a new patient, if they've been on it and they need a break, that's one thing. But somebody who comes in for initial consultation, I recommend it. And I know that kind of some people recommend it, some don't, based on, will the laser not pick up the pigment as much? If you don't have as much pigment, just go up in the joules, go up in the setting, go up to a 6 or a 5 or 6 in terms of energy. The point is you can always go up to target the melanin, but they're going to be happier if they come back after the first treatment and have less pigment. So you want to treat them with the Aerolase, but also add in something like a Triluma or hydroquinone as well.
And so is that a standard thing that you do for melasma, just in terms of keeping rebound down? Is there something special you do, or is that kind of like the go-to regimen?
Yep. So I recommend, Triluma is one. I also am now using a compounding pharmacy that actually has a higher percentage of hydroquinone that compounds hydroquinone, retin-A, tretinoin, as well as a topical steroid. So similar, but it's actually much higher strength. It's 8%. And then, when I have them take a break after 3 months, so it's 3 months on, 1 month off, let's say, then I keep them on something that they can just use to kind of keep, quote unquote, the pigment down, right? So there are more the natural treatments. Again, Naya has a depigmentation serum that I really like because it's gentle and that's more for the maintenance. But I absolutely recommend that to everyone who has melasma. I get them on a hydroquinone, a good sunblock, obviously a mineral sunblock with titanium or zinc oxide, and tell them obviously hats, etc. But I think you have to address the day-to-day protection and also a treatment at night as well to decrease that pigment production.
Okay, excellent. And then we have a question here about combining the chemical peel with the actual laser treatment itself. What do you do first?
The laser first, because you want the skin to be as dry as possible, meaning it can, obviously this technology is attracted not only hemoglobin, melanin, but also to water based on the wavelength. So you want to make sure that the skin is dry and clean, and obviously we neutralize them after the glycolic peel. I like Personally, I like to put on, I actually put on the Naya. They have a rapid redness repair that's just soothing to the skin. I put that on, and then I put on the Glow if they're not, acne prone. But the point is, you don't want to apply anything after the peel if you're going to be doing the laser. So always do the laser first.
Okay. And then back to the point about the pre-regimen in terms of like stopping the hydroquinone, or if they've been on it for a couple of days or a while, do you have them stop a couple of days beforehand, or you keep them on the regimen?
I can't say that. I typically just say go ahead and stop any topicals that could irritate your skin, such as Retin-A, Triluma, hydroquinone, 48 hours before. And I will tell you, the reason I kind of hesitate is I've absolutely had numerous patients that I forgot, and they don't get irritated. So, I haven't found that there's really a big difference between the two, but if you get into the standard, just saying stop at 48 hours before, don't use it 48 hours after. But the nice thing is this is such a gentle treatment, such a gentle technology, very different than IPLs or other, more aggressive lasers. You don't really have to, and that's the beauty of it. If somebody forgets, you don't have to worry that they came in the office and they've been using a Retin-A or something up until the day you're doing the treatment. You can have them stay on their regimen with no concern, but I just say it more out of habit to have them stop, but you don't have to worry about it with this technology.
Okay. Going on that, we have a question from Dr. Baral here. Can this be used on liver spots on the hands?
Absolutely. Now, I will tell you that with liver spots, sunspots, whatever you want to call it, solar lentigines, I have found that, it absolutely lightens them. There aren't many devices, in my opinion, out there that are so wonderful for it, because a lot of it's just like pigment that's kind of clustered, and it's going to come back if you have 2 or 3 cells there anyway. The point is that it absolutely can be used. It absolutely lightens them. I will just say that I preface to the patients, look, this will lighten them. It will make your skin look better. It will make the skin look healthier. It's not going to get rid of them 100%. But in combination, you can use something like a hydroquinone or another lightening cream to continue to lighten them, and obviously sun protection. I think it's a very good treatment, but just make sure you're setting realistic expectations. But absolutely, it can be used anywhere on the body and anywhere.
Okay. All right, switching gears a little bit, we have a couple of business questions. First off, as we always do, we have a couple questions about pricing. Now, pricing obviously differs wherever you are. It differs by area, by market. Are there any, tips that you can give in terms of pricing for just the laser and for pricing for combination treatments like the glycolic peel?
Okay, good question. So I actually kept it the same as what we were charging for IPL at the other office, which is probably a little bit on the higher end from what I've heard for other, people using this particular device. But I charge $500 for the face. I charge $250 for each additional area. And, the exfoliation with the glycolic or the lactic acid, pads, obviously I don't charge extra. If I do a glycolic acid peel, typically on its own, I charge $150. I decrease the cost to $75, so I cut it in half to give them a little bonus. I just say, it's a little add-on treatment because it takes 2-3 minutes. But the point is, I always tell my patients, particularly the ones that have had IPL in the past with me, and I have a lot, obviously, of return patients that I had at the other office, they say, look, this is very similar in terms of what I'm trying to do with the device. However, it's better for this reason, that reason, etc., but it's the same cost. So meaning, they're used to paying $500 for the IPL. They're happy with the results, and they know they're getting a similar treatment, but it's actually better for other reasons. And they're happy. They're like, oh, okay, I was paying $500 for this, but actually I'm getting a better treatment at the same price. Fabulous. I've also heard that some practitioners base the pricing on time spent. So you might charge, let's say, $250 for each 15 minutes that you do the treatment. So if you're able to do the face in 20 minutes, you might charge $300, or if you're able to do the face in, 30 minutes. So basing it more on time, which is not unreasonable, particularly when it comes to laser hair removal, because that can get a little tricky depending on density, location, etc. But I kept it the same as the IPL, so that's how I've guided my cost.
Okay, excellent. And then we have two questions here from Rosa Laura, which I think are pretty interesting. Now she says, millennials are a strong population. Now, do you find that they have strong buying power? And do you find that they're hesitant to buy a series of treatments as opposed to just a one-off treatment?
Absolutely not to the buying a series. I think actually most millennials like that because obviously you give a little bit of a discount and you say, well, I think you need 3 treatments, but here you go if you buy it as a package. I think they like that because they're getting a discount one, but also they're setting in their mind expectations of, okay, I need to come back and I'm going to be doing X, Y, and Z. And so it's setting kind of that calendar for them. And we know that millennials like a plan. They like to know what's coming up next. They like to be a step ahead. So I think that's actually a better way to approach millennials rather than one treatment. The other thing I will absolutely mention is millennials want results. And I think a big mistake you can make is telling them, well, it's X, it's $500 per treatment. Let's start with one, and they're not going to be happy because they're going to come back and say, yeah, the results I love the results. However, I want this endpoint. And we all know that it's going to take 2, 3, 4 treatments to get to that endpoint. So pushing them to get the series to make sure by the end of the series they're, at their goal, I think is huge. And then in terms of spending power, at least in my practice, they will spend. They will spend on their looks. They will spend on how they feel. They will invest in themselves. I think it's a very strong population for spending because they see I'm going to bring up her name, everybody says it, Kim Kardashian, and oh, her skin looks great. And they want that image. So they're willing to spend the money on it. So I think they're a very strong population to get in the door, and they will spend once you get them, connected with you and confident in what you recommend. Confidence is key with them.
That's a good segue into the next question she had was, so we talked about millennials. They're a lot different than a lot of the patients that you do see, the typical patients. In terms of objections from millennials, are there any more common objections that you see, and how do you overcome those?
Objections as in why they wouldn't want to do the treatment?
Why they wouldn't want to do the treatment and go forward with it, or I guess.
Okay, got it. Got it. Yeah, I would say, in general, and millennials, but I would say any patient, obviously if they want results in one treatment, you say, okay, well, I can make your skin look healthier, but you can't set any realistic expectations because I'm extremely realistic. The last thing I want is somebody come back and say, oh, you told me I was going to get this result and I didn't. I think that anyone that turns away, which I think has maybe been one patient, almost everyone loves the sound of fast, quick, no downtime, no pain, great results. But I did have a patient who said, I want X results by essentially this wedding. I want these results. I'm like, look, it's unreasonable to do this one treatment and expect X. So I don't think millennials are unique in that. I think millennials are actually they don't push back as much. I think once they trust you, once you educate them, and if you educate from the first moment you start talking to them about the treatment, they will trust you, and they are much easier to hook, I think, than, a different population, because once they feel educated and they believe in it, they go for it. So I would say millennial objections are very, very rare, at least in my, my circumstance.
Okay. And then switching gears again, going back to marketing to these millennials, can you describe your most successful campaign that you've done, what platform it was, and what it encompassed?
Most successful, to be frank, was me posting my own pictures. I cannot tell you the number of patients, and granted, it was the beginning of me offering the treatment, so word was starting to get out. But the number of patients that follow me on Instagram and are like, oh, I saw you did this yourself, tell me more about it, where I posted other treatments on this patient, that patient, and they don't tend to come in as much and say, oh, tell me about this treatment I saw. But when it was me and they're like, oh, you did this, it sparked a whirlwind. So I would say that has been extremely successful for me. The other thing that's been extremely successful is sending out e-blasts. Sending out an e-blast to announce the device, it obviously gets questions, call the office, here's, 20% discount, announcing this new device. And if you've had the device, but you still want to market it, just throw in a special, it's, February, whatever, and just throw out an e-blast, market the material, educate the patient in the e-blast, talk about the device, because I think that's another mistake people make is they just throw out a picture of the device and the name and 20% off. Well, you have to explain, you know, this device, which is intended for da-da-da, we're so excited about it. You know, if I actually sent the e-blast with my own picture. So, you know, I did this device and I love it. So I think, you know, really trying to connect and educate even in the email blast is really important.
Okay. And then here's a question. I think you did a great job on this, keeping loyal patients. But in terms of having millennials leave your practice for cheaper price points, we all know there's a ton of competition out there. Do you find that some of your patients are looking for better deals? And is there a point where you say this patient is not worth keeping?
Yes, I absolutely have sometimes patients come in that mention, you know, you cost this much, or that cost. I love how they say it, like, oh, you cost this much. I'm like, you know, price tag. But the point is, they want to compare. Well, can you meet this price? And I never price reduce. I say this is my price. You know, essentially, I know that I'm worth it, and I'm going to do something different. I haven't had such an issue, to be frank, with this particular device because it's not as well known. People don't have it. And I think that that's another point that I should have made earlier is that be unique. I mean, everybody knows about IPLs. Everybody has IPLs. And I'm not saying I like IPL, but to have a device that you say, okay, you know, this is different than, you know, most people in my area, or this is unique because I can use it on X, Y, and Z. And to be able to say that to a patient when you recommend a treatment, I recommend this is a great treatment for you. And then they say, well, but I can go get an IPL for $250. And I say, sure you can, but here are the reasons that this particular treatment is a better option for you. And yes, it's a little bit more expensive, but here's why. It's new technology. You're going to have no downtime. The results are going to be even better. You're getting more collagen stimulation. Be knowledgeable and give them all the reasons that it's worth the price. And they're not going to fight back. So I've rarely had a patient, you know, say, oh, you're too expensive, or this is too expensive, or I can get it for cheaper here, because they see that I'm educated and that I'm offering something different than another provider can offer. And, you know, I would say Botox fillers might be a little bit of a different story, but that's out of the scope of this particular webinar. But just offer something different and they're not going to argue because they're going to want that treatment.
All right, I think that's excellent. And really, education is the key at this point. So we are going past the 9 o'clock mark here, and so I just want to put a last call in for questions with respect to everyone's time. And Dr. Del Campo, is there any closing remarks that you have for us that you would like to take away from this?
No, I mean, I think, you know, at the end of the day, you have to look at your patient base and really figure out what you're trying to target, what you're trying to treat. And, you know, I think Aerolase, one thing I love about, you know, the Aerolase team is they're really doing this just to educate you guys and really just get the word out about millennials and how you can improve your practice and things to think about. Yes, I think this device is spectacular. Yes, I think this could fit into any practice. Yes, I think that this is great specifically for the millennial population. But the point is, with whatever device you purchase, you really have to sit down and look at numbers, ROI, and that's exactly why, you know, I did the algorithm with Tina, was really because that's not something that's been looked at before. It's not something that's been put into black and white, you know, for people to be able to really sit down and providers to think about. So just think about your clientele, look at numbers, see what's going to fit into your practice. But at the end of the day, buy something not only for your patients, but for you. I love using this. It's fun for me. It's easy. I mean, to be frank, I don't stress out over people having issues when they leave the office. I mean, it's something I don't have to worry about, and it's easy to use, and it's fast, and I like using it. So the point is, purchase something that not only is going to help your patients, but that's not going to add stress to your day-to-day life because you're worried about them when they leave the office, or you're worried they're not going to like the results. So buy it for yourself just as much as you're buying it in your practice, just as much as you're buying it for the patient. And that's it.
All right, awesome. All right, so everyone, thank you so much for joining us tonight. Dr. Del Campo, awesome presentation. Thank you for the Q&A. And again, if we did not get to anyone's questions, we will address those later. So everyone, have a great night. Again, thank you, Dr. Del Campo.
Thank you, guys.